Welcome back. More countries are reporting cases of the Zika virus. A man in Denmark was diagnosed after travelling to Brazil and Mexico, and 2 people in Switzerland came down with the virus when they returned from Haiti and Colombia. There are also cases in the US states of Arkansas and Illinois. But it's Brazil that is viewed as ground zero for the virus, which has been linked to a severe birth defect. Shasta Darlington is covering the developments in the city of Recife and joins us now. Shasta, when was it first discovered in Brazil and how quickly is it spreading?
Well, Lynda, it first cropped up here in Brazil in the first half of last year. In fact, the first cases were discovered right here in the state of Pernambuco. And ironically, officials really shrugged it off at first. The symptoms are pretty mild, just a rash, a headache, maybe a low fever. So it wasn't until a few months later when they noticed a huge surge in birth defects, this microcephaly, babies born with small heads and brain damage, that they started doing an investigation and found a link between the Zika virus and the microcephaly. And obviously that's when the alarms really started going off. And since the Zika virus was first detected, they've actually reported more than 4,000 babies born with microcephaly here in Brazil. So it's being taken very seriously. Doctors and health officials are warning women to put off getting pregnant if at all possible. Here in the state of Pernambuco, more than 30% of the cases have been right here, the cases of microcephaly. So you sort of can feel a certain sense of panic. Those women who were already pregnant, really concerned, going to the doctor, getting their checkups to see if they could possibly be carrying a baby with microcephaly. Also because in 80% of the cases, Zika actually doesn't have any symptoms. So a lot of uncertainty and a lot of fear here, Lynda.
As you mentioned, in Brazil and also El Salvador, women are being told to delay pregnancy. But is that really possible in certain areas that are really highly religious?
I think that's a really good question, Lynda. And here I have to say, Brazil isn't making it an official policy. They aren't telling women don't get pregnant. But when you speak to the individual doctors and individual health officials, they'll say it's common sense. If you can, put it off at least a little bit. We're doing the research, and we just happen to be in the middle of the rainy, muggy summer months down here when the mosquitoes that transmit the Zika virus really multiply and they thrive. So on the one hand, you have the issue, how available is birth control? How willing are people to use it in the world's largest Catholic country? Officials are trying to make it more available. We're just about to head into carnival season, and they're passing out condoms freely, and they're encouraging people to use them. So they're doing what they can to educate and encourage people to think responsibly about whether or not this is a time to be having a family. But it's a lot of the mothers that we've met right here in Pernambuco, they're teenagers, they already have children, and they're just not emotionally or financially prepared for this, Lynda.
Okay, Shasta Darlington in Brazil, thank you very much. Well, let's take a closer look at the danger the Zika virus poses to babies. I'm joined by Dr. Peter Hotez in Houston, Texas for that. He's chair of tropical pediatrics at Texas Children's Hospital and the dean of the National School of Tropical Medicine in Houston. Thanks so much for being with us. Firstly, as Shasta said, the symptoms are quite mild for people that have it, but as I understand it, 80% of people with the virus don't even show symptoms.
Well, we really don't know because nothing has been published in the biomedical literature. This is all kind of happening through informal mechanisms, through World Health Organization alerts, through social media, through emails to colleagues. So we really don't know the percentage of women who are asymptomatic. But whatever it is, oftentimes they have mild symptoms. The big story, I think, with Zika is the fact that a certain percentage of women who become infected while pregnant are passing that virus onto their unborn babies and causing this horrific congenital birth defect.
So how does the virus exactly affect unborn babies, and how quickly can pregnant women receive screening after going to an affected country, and what does that involve?
Well, the virus, we don't know exactly the timing. We think it's when a woman gets infected in the first trimester of pregnancy, maybe into the second trimester, maybe around the time of conception, that the virus gains access to the woman's bloodstream. It passes through the placenta, then into the baby's central nervous system, where it's causing severe growth delays in the baby's brain and skull, and this is what leads to microcephaly and this birth defect. So we're now trying to work out algorithms to determine what the best route would be for testing and when to do ultrasounds. Remember, this is all very new. We did not know this virus could cause microcephaly in large numbers until around October last year when it was reported out of Brazil. So everyone's playing catch-up. Obstetricians across the Western Hemisphere are playing catch-up. Public health agencies like the CDC, we're all trying to get our arms around this since we've never seen this kind of behavior with an arbovirus, a virus transmitted by a mosquito. The closest thing to it is when we saw a lot of congenital rubella infection back in the early 60s before we had a vaccine, where we had a big problem in Philadelphia and the United States. 1% of pregnancies were affected by congenital rubella virus. What came to the rescue then was a vaccine. Unfortunately, we're still a couple of years away for a vaccine for Zika virus.
So the research really, obviously everyone's working quite fast at the moment. I understand there were 2 cases of pregnant women in Illinois that have been diagnosed with the Zika virus. Does an ultrasound determine whether their child has the virus, or is it also a blood test?
Well, an ultrasound can detect microcephaly, the small head size, and the abnormal brain development. The problem with ultrasound is most obstetricians, I'm told, can't really pick it up by ultrasound, according to my colleagues, until around 24 to 28 weeks gestation. So in the United States and in at least 20 states in the U.S., it's illegal to even consider performing abortion after 24 weeks. So all the ultrasound is doing is really documenting what's going to happen. It's really not doing anything preventative. So we need better testing early on in pregnancy to see if a mother's infected with Zika, and then take appropriate measures.
So is there a blood test at this stage for the Zika virus?
There is. So what you can do is take blood and do what's called a reverse transcriptase PCR, which is a test that actually detects the genome of the virus. And right now it's currently being done in the United States at the Centers for Disease Control Reference Laboratory for arbovirus in Fort Collins, Colorado, and so physicians are sending samples there. I should emphasize that right now we do not have transmission in the United States, but I'm quite worried about how rapidly this virus is spreading. It went from Brazil, causing more than 1 million cases, to Colombia, South America, where there were 700,000 cases. Now it's in southern Mexico and Central America. It's knocking off various Caribbean islands, so I believe by the end of February, where the entire Caribbean is going to be affected. And I think there's a real risk to the Gulf Coast of the U.S. I'm particularly worried about areas of extreme poverty. Poverty, no one's really talking about this, but poverty is a major risk factor for this virus because you're living exposed to mosquitoes, you don't have adequate window screens, you don't have air conditioning, you have environmental degradation, which allows mosquitoes to proliferate. And so those conditions are now present in northeastern Brazil. They're clearly present in Haiti. I think Haiti could get hit very hard. And oftentimes, people don't realize the level and depth of poverty on the Gulf Coast of the United States and the poorest areas of Texas and Louisiana, for instance.
Absolutely.
So I think we have to consider that those areas are vulnerable as well.
Peter Hotez, we really appreciate your expertise on this. Thank you very much for joining us.